Hi friends. So first of all, we have learned the respiratory systems, embryology, congenital anomalies and stuff. Now we are going to deal with anatomy. So respiratory systems, anatomy, when we say that, mostly we have talked everything in embryology itself, but we'll go into a detailed version. So we see, we have in respiratory system, we have trachea, we have bronchi, we have bronchiole, we have terminal bronchiole, we have respiratory bronchiole, we have alveolar duct, we have sac, which has alveoli, right? And we know that in trachea we have a ring-shaped cartilage, in bronchi we have hyaline cartilage, where in the bronchiole we don't have cartilage. We know these things. Okay. Now, we know that till here it's conducting zone. From here it is respiratory zone. That is the respiratory bronchiole up to the alveoli we have respiratory zone. Till terminal bronchiole we have conducting zone. It's also known as anatomical dead space. And we should know the cell type, the epithelial type of trachea, bronchi, bronchiole, terminal bronchiole, respiratory bronchiole, and alveolar duct and stuff, right? So in trachea and bronchi, we have pseudostratified columnar epithelium. That means, in pseudostratified, that means the nucleus won't be in one layer. It looks like it is two-layered, but it is not two-layered. It's just that the nucleus is above in one cell and nucleus is down in other cell, so that is pseudostratified, ciliated columnar cells in both here and here. Okay. We have pseudostratified columnar epithelial cells. Along with, we have goblet cells. Goblet cells that produces mucus. We said special type. We said that we have goblet cells here, we have club cells here, we have pneumocyte 1, pneumocyte 2 here. That was the special cells. We have dealt with it in the embryology. Anyway, the special cells are goblet cells here, which is producing mucus, and it's pseudostratified columnar epithelial cells with cilia. We know the cilia is for removing the mucus. This is mucociliary escalator system, right? So that is there. This is both the trachea and bronchi, which has pseudostratified columnar epithelial cells ciliated. Next we have columnar ciliated cells. Columnar ciliated cells, in which? In bronchiole. But we don't have what? We don't have cartilage in bronchiole. We have only hyaline cartilage in bronchi, but we don't have it in bronchiole. There is no cartilage in bronchiole. It is just epithelial layer and smooth muscle, right? But here we have epithelial layer, we have smooth muscle, and then what do we have? We have cartilage. Which cartilage? Hyaline cartilage. Okay. So, but in bronchiole we have ciliated columnar epithelial cells and smooth muscle, no cartilage. Next we have this terminal bronchiole. We'll deal with terminal bronchiole. In terminal bronchiole we will see cuboidal cells. What do we see? Cuboidal cells. And we also know that in bronchioles, both bronchioles, we'll have what? We'll have club cells. What cells? Club cells. We said club cells are cells that is fighting against toxins with the help of cytochrome P450. That is the club cells. And we have ciliated cuboidal cells in the terminal bronchiole, columnar and columnar. Here we have cuboidal cells, and also there is club cells in bronchiole. Next, this cuboidal cells will be transitioned into squamous cells in a respiratory system. So it's like columnar will be turned into cuboidal, will be turning into squamous. Okay, columnar into cuboidal into squamous. Okay. So cuboidal will be there in terminal bronchiole. Squamous transition will be there found in respiratory bronchiole, and they will when it's squamous, there won't be any cilia, right? it is seen here and here, but there is no cilia. So this squamous cells will be there, and cilia will be ending in the terminal bronchiole itself. Okay, so or we can say, yeah. So there is club cells here. We know in bronchiole we have club cells, and we have squamous cells here. And this squamous cell will be going to go to this alveolar duct shaft. So, and in alveoli, we know two cells are there. What are these cells? One is cuboidal shaped type 2 pneumocyte, and squamous shaped type 1 pneumocyte. Okay, this is for YA16s, and this is producing surfactant. We deal with it. This is producing surfactant, as well as it is a stem cell which proliferates when there is a lung damage. So there are two types of cells here in alveoli, and this cuboidal shaped type 2 pneumocytes are seen in clusters. Yes. So that's there. It's nothing much. And also we have alveolar macrophage. What do we have? Alveolar macrophage. It produces cytokines and proteases. We know macrophages produce cytokines and proteases when they phagocytose some particles. So they produces what? They produces proteases, cytokines, phytinicanes, phagocytizing foreign particles. So there is alveolar macrophagia. So that's basically it. And there is also capillaries found, rotating this alveoli and stuff. Okay, there's capillaries there, there's alveolar macrophages, there is two kind of cells, and this is the cells that is there in the respiratory tract. Next, we are dealing with lung anatomy. Lung anatomy, we'll deal with it. Is this is right lung, and then we have left lung. Right. So, but we know that in between the lung there is an area called mediastinum where the heart is being located, right? And we know that heart is tilted towards the left side. So it's not here that the heart is there; it's here that the heart is there. So the lung is like it's very decent. They provide space for heart. So there is a space for heart, right? So the left lung is shaped like that, okay, leaving space for the heart. Okay. Now we'll have to know how many lobes are there. For easiness, we'll say in a right there is three right. See, there is R in both. So right has 3 lobes, left has, so that's what left has 2 lobes. So which is the fissures that divide the lobes? We'll see it. There is horizontal fissure, and there is what? There is oblique fissure. Okay. And here we have only oblique fissure. Right? So there is 2 lobes here, there is 3 lobes here. One is horizontal fissure, oblique fissure, oblique fissure. And we must know one more thing. This is very important, that in trachea, trachea is there. It is divided into 2 bronchi, right? Bronchi. But let me tell you something. It's not just like this. There is a particular thing that you have to concentrate, which is the right-sided bronchi has very little deviation. The deviation is very little. But in here, the deviation is more. Understand? There is very little deviation from the tracheal direction. Tracheal direction and the right-sided is very little deviation, while the left-sided bronchi has much more deviation from its direction. So therefore, if we aspirate anything, most probably it will enter into right-sided bronchi. So therefore, it's very important. So anything aspirated most probably will go into the right-sided lung. And also we have to know that if that person is in upright position, the gravitational pull is towards downside, so it will be there in the right lower lobe, where it will be right lower lobe. And if the patient is in supine position, is lying down in supine position, then it will be most probably in the superior part of the right lower lobe. And if he is in, inclined, if he is in inclined towards the right side and is lying down, then most probably that aspirated thing will be found in the lower portion of right upper lobe. Okay. So these are the positions where if the person is aspirating something, then it will be found. So this is all about lung anatomy. And also we have to know one more thing, that we know that from heart is divided into 4 chambers, and from this right sided ventricle we have pulmonary artery that is coming up, right? Pulmonary artery. So pulmonary artery will be divided into 2. One is a right sided pulmonary artery, the second one is left sided pulmonary artery. So in right sided pulmonary artery will be anterior to the right bronchi, while the left sided pulmonary artery will be superior to the left bronchi. So for easiness, we have a code called RALS. Right anterior, left superior. Left pulmonary artery will be superior to the left bronchi, and the right pulmonary artery will be anterior. It is anteriorly, it is superiorly. Understood? So this is all about lung anatomy. We know that trachea is divided into right bronchi and left bronchi, and this division, this place is known as carina. What is known as carina? So carina is anterior towards the descending aorta and posterior towards the ascending aorta. So it's very easy to understand, right? So that's there, and there is an X-ray diagram which I will show in the video hopefully. So, and next we are going to deal with diaphragmatics. So we are dealing with diaphragmatic structures. Diaphragmatic structure has diaphragmatic openings. So we know that in the heart we have in the front we have inferior vena cava that is descending. So this inferior vena cava will come through this. Then we have esophagus below that, and then we have aorta, which is adjacent to the vertebral body. Okay. So all these openings, inferior vena cava, esophagus, and aorta, have accompanied by some other structures, which is inferior vena cava have right phrenic nerve, esophagus has vagus nerve, aortic hiatus is accompanied by thoracic duct as well as azygous nerve, azygous vein. Okay, we know all this stuff, and now we have to see if what is the position of this, because diaphragm is arranged like a dome-like structure. So one will be opening here, the other one will be opening here, the other one will be opening here. So that is, it is inclined, right? So it's some positions are different. The positions are different. So here we have T8, we have T10, we have T12. Understood? So inferior vena cava is opening at the 8th thoracic vertebrae, and esophagus hiatus is seen at the 10th thoracic vertebrae. Aortic hiatus is seen in the 12th thoracic vertebrae. So these are the openings and stuff. So it's very easy to understand. Now, what are the innervations of diaphragm? The innervation of diaphragm are C3, C4, C5 phrenic nerves. Okay, these are the innervations of diaphragm. And this is all about diaphragm, but as an extra point, I would like to add that do we know about bifurcations? What are bifurcations? Bifurcations are division, right? The trachea is divided into 2. It's a bifurcation. And the common carotid artery is divided into 2, right? And the abdominal aorta is divided into 2. We know all this thing. The trachea is here, common carotid is here, and then we have abdominal aorta here, right? So all this stuff is bifurcations. So it's very easy to understand which are the positions, because bifurcations, it is bifurcations. Which all are they? The trachea will be found in where? T4. The common carotid will be formed in where? C4. And the abdominal aorta will be formed in L4. So it's all 4, We know the trachea is in between here, so it's a thoracic place, right? It's here, and abdominal aorta is here, which is in lumbar place, so L4, and common carotid is here, which is like cervical place, so it's C4. It's very easy to understand, it's very easy to number, so it's just logic stuff. Bifurcations by how many? 4 occasions. L4, C4, T4. These are all the openings and stuff of diaphragm, and innervations of diaphragm is also important. And one more thing I would like to add is that if a phrenic nerve is cut, if there is a cut to this phrenic nerve, then there is this paradoxical movement of diaphragm. That means, if the breathing will be there, the diaphragm is something that is helping in normal respiration, the quiet respiration. It is the diaphragm that is helping in quiet respiration. So if a phrenic nerve is cut into one part, the one part will be here and the other part will be like that. So there is paradoxical movement. Usually the whole diaphragm should be like that and like this coming back. But if there is a phrenic nerve cut, it will be like this coming. Okay, there will be like paradoxical movement. It's not normal. It's paradox. So it's an extra point towards this diaphragm. So I hope you all understood this stuff. So this is all about lung anatomy and anatomy of respiratory system. Now we are going to deal with physiology of respiratory system. Thank you all.